How can I tell that some women might be insulin resistant or diabetic just from doing a pelvic check? Hi, I am your local OBGYN. I love women, and let's talk about this. There are a few telltale signs of insulin resistance and elevated sugars, and one of them has to do with a pigment change in our skin, where there's like a thickening and sort of a velvet texture that we can see to the skin that looks very different from the rest of your body. And this is called acanthosis nigrans. So it is this darkening and this velvety texture that is a result of poor sugars. And I can see this very commonly in the back of somebody's neck when I'm doing an exam, but I can also see it in their groin area, not necessarily on directly their girl parts, but in the folds at the top of their thigh, where it is another common location for it. If I do see this, I start to ask if patients have been recently screened, and if they haven't, offer to get them at least some sugar testing or to go back to their primary for further evaluation, because it can really tell me a lot. This particular finding can also be really helpful depending on what the complaints are for the person, like recurrent yeast infections or irregular cycles, which may all tie into the hormonal imbalance related to insulin and sugar.